So let me ask you about the vaccines, Dr. Sneed. Do you trust the safety and effectiveness of the vaccines? And why should others be so confident?
Actually, I do trust the vaccines, and I'll tell you why. Again, I think we have not done a very good job of messaging to the public exactly how long we've been working on these particular vaccine platforms. Many people kind of woke up and felt that we walked into a kitchen on April of 2020 and began making a brand new type of vaccine platform. And nothing could be further from the truth. As a matter of fact, one of the companies that's now continuing work actually started work on these messenger RNA vaccine platforms back in 2001. During the original SARS-CoV-1, or the original SARS, there were groups that continued doing work since 2005 all the way up until now. And also, a lot of the research has actually kind of evolved from work we've already been doing in cancer research. So there have been numerous and almost countless numbers of clinical trials and clinical research for over a 15 to 20 year period around the current vaccines that we're using, but I'm not sure that we message that appropriately to the public.
Right.
And so I have a much greater confidence in terms of what they can do for the body, how they work in the body, and really how safe they are for human beings to be able to take them.
It builds into this narrative that there are a few people who are out there to get us as citizens, and that we must defend our individual rights. But in most cases, in frankly all cases, as you peel back the layers of the onion of the truth and the facts, you find that all of these conspiracies are built on a foundational lack of evidence, right? So most recently, the conversations are around magnets that are in the vaccine. This is not true. You can test this yourself. I guess put a magnet next to your arm, see if it works. We are seeing people who are, frankly, in my opinion, profiting off of vaccine misinformation in a way that is dangerous, unhealthy, and something that we should all be aware of. I will end this kind of section with this, is that it is natural for us all to be skeptical naturally of anything, right? And I'm glad we are, right? What we fail from as a society, we are skeptical about things that we do not believe, right? So if you believe the world is round, as we all do, any information you see online that says, no, the world is flat, you're going to be skeptical of it. You're going to be critical and think, well, who's saying that? What's the source of that information? We do not have the same levels of natural skepticism when we see something that confirms our world belief. So, for instance, if you're a person who believes that vaccines can cause autism, if you see any information online that supports that conclusion, you are more likely to believe it. You are not likely to be skeptical of it. And that is a failing of our brains and the way our brains work. Because if we had the same level of skepticism in both ways, I think we'd be much better positioned to kind of fight back against these misinformation attacks.